How do you take care of your parents' medical bills without draining your own retirement? It's a question that's becoming all too common. I recently saw a Reddit post that really captured this fear. The user asked, how do you handle medical costs for parents who have no savings, and how do you set boundaries so you can help without hurting your own finances? It's a heartbreaking situation, but it's also a practical one that requires a plan. If I were in a similar situation, I'd answer 4 questions to help uncover hidden resources and, more importantly, set boundaries to protect my financial security, beginning with question number 1. What coverage do they actually have today? Most families say, oh, my parents have Medicare, and they just stop there. But Medicare isn't just one thing, it's a foundation, and how it's built determines whether a hospital stay costs a little or a lot of money. You can't start planning until you know which of the 3 paths they're on. Path 1 is Original Medicare. This is the traditional government program where Part A is for hospitals and Part B is for doctors. But here's the catch. Original Medicare has gaps like deductibles, co-pays, and co-insurances that can add up fast. That's why many people add a Medigap or supplement plan to pay for those leftover bills. If they have this combo, their out-of-pocket costs become more predictable. Path 2 is Medicare Advantage or Part C. This is where a private insurance company takes over. These plans often include extras like dental, vision, and hearing, which is great, but they also have specific networks of doctors. If your parent sees a specialist out of network, you might be the one left holding the bill. And Path 3 is the safety net layer with additional benefits. Do they also have Medicaid because of their low income? Do they have retiree coverage from an old job or VA benefits? These programs work alongside Medicare and can be a lifesaver for long-term care or prescription drug costs. Here's your homework for this step. Don't just take their word for it. Find their insurance card, because that one piece of plastic can tell you which path they're on, and you can get a clear picture of your family's financial exposure before a crisis hits. Once you know what coverage they have, you have to tackle the second question, and this one actually catches a lot of people by surprise. Question 2 is, what is this insurance actually going to leave behind? It's about finding the hidden gaps that affect your parents, and there are 4 massive gaps you need to watch out for. Dental, vision, hearing, and the big one, long-term custodial care. Families assume Medicare pays for nursing homes. It doesn't. Medicare covers skilled nursing, which is medical care and rehab after a hospital stay provided by a licensed medical professional, usually at a skilled nursing facility. But custodial care, which is the daily help with bathing, dressing, or meal prep, is considered personal care, not medical care, and Medicare generally pays $0 for this. The distinction is the difference between a small and a massive bill. Your action step for this question is to conduct a care gap audit. I've put a link in the description to Medicare's official list of what's not covered. Take that list and compare it to your parents' current health and ask yourself questions like this. Are they starting to struggle with mobility? Or do they need new hearing aids? Once you identify which gaps are actually at risk for your family, you can stop worrying about everything and start prioritizing the costs that actually matter. Because once you know the gaps, you have the answer to the hardest question of all. Question 3 is, are we actually getting every dollar we're entitled to? I look at this in 3 levels. Level 1 is the low-hanging fruit. Is your parent seeing in-network doctors? Are they using generic medications? And here's a pro tip. Check the website of the company that makes their most expensive medications. Many manufacturers have patient assistant programs that can provide drugs at a fraction of the cost or even for free, regardless of insurance. Level 2 is the structure. If the out-of-pocket costs of Original Medicare are crushing your budget, it might be time to change the path we talked about earlier. Would a Medicare supplement plan give you more predictability? Or would a Medicare Advantage plan cover those dental, vision, and hearing costs that are currently coming out of your pocket? Level 3 is the safety net. This is one of the most overlooked areas. There are state and federal programs designed specifically to catch families who are struggling. The Medicare savings programs can help pay for Part B premiums, deductibles, copay, and coinsurance if your income is below a certain limit. And Medicare Part D Extra Help is a federal program that specifically helps people with limited income and resources cover prescription drugs. And finally, check if they're a dual eligible. A lot of people think it's either Medicare or Medicaid, but in reality, you can have both. If your parents have limited income and assets, Medicaid can step in to pay for the premiums, copay, coinsurance, deductibles, and most importantly, it can often cover that long-term custodial care that Medicare won't touch. Eligibility varies by state, but if your parents are living on a fixed income, this is one of the first phone calls that I would make. Finding these programs is like finding a hidden scholarship for your parents' healthcare. But even with all this help, there might still be a little bit left over, which leads us to the fourth and final question. What help is available for the day-to-day costs that are draining their budget? We often focus so much on medical bills that we forget about the life costs for things like groceries, electricity, basic help around the house. And if we can find support for this, it frees up your parents' limited cash for their actual health care. Here are the 3 places I would look to first. First, find your local area agency on aging, or AAA. This is a nonprofit organization designated by your state to help older adults stay in their homes. They can coordinate a wide variety of services, from home-delivered meals to homemaker assistance, which is someone who can come help with the chores that have become too difficult for your parents to handle. Second, look at food and social support. Programs like Meals on Wheels provide more than just a free or low-cost nutritious lunch. They provide daily safety checks and social interactions. I'd also really look into SNAP benefits. For an older adult on a fixed income, extra support for groceries is a massive financial relief. And finally, if your parent is a veteran, check the VA's home and community-based services. The VA has programs that go far beyond standard clinics. They offer home health aides, adult daycare, and even respite care to give you, the family caregiver, a much-needed break. These services are designed specifically to help veterans age safely at home while reducing the financial burden on the family. By answering these 4 questions, you aren't just handling a crisis, you're building a sustainable plan that protects your family's dignity and your own financial future. If you found this helpful, please hit that like button. It helps this video reach other families who are navigating these difficult conversations like you. And if you have a specific question about your situation that your family is facing, leave a comment. I read through them to find topics for future episodes of You Asked, I Answered. I'm Shami, a healthcare finance consultant, and thank you so much for watching Insured and Informed. I'll see you in the next one.